Hello guys and welcome to RNscrub. Today we're going to be going over how to insert an IV. So as you see here we have our IV start kit, the gauge needle that we chose, and then we have a 10cc normal saline syringe connected to an extender or an extension kit for the IV, and that's what you're going to place on after you find your IV. And then here you have gauze. You have your tourniquet, and of course you perform hand hygiene, but we didn't want to waste any gloves or materials, so we just went ahead and we're going to pretend that we have gloves on. So first off, you're going to want to assess both of the patient's arms, and then you choose the arm, choose the vein, preferably in the area that you've already looked at, and you find a really spongy one. Now this is a little trick. You're going to go ahead and just indent the skin. It's not hurting the patient, but it is a little marker if you choose to go ahead and take on this tip. And then you grab your alcohol swab or your CHG sponge, and then make sure you clean it well enough for 30 seconds or per hospital policy, and then you let it dry for 30 seconds or per hospital policy, and you grab your needle. In this case, this is an 18 gauge, so we're going to pretend that we're going to give a bolus. And that's something to keep in mind too, is your needle size. If you're going to give a bolus, you want a larger size, and if you're just putting a baby one in, then that's fine. A 22 gauge is okay too. So as you see here, this is the bevel up, and find where you marked it. You're going to want to go in about 25 degrees and then 15 degrees and then pilot, and then you push right through. Now you don't want to advance the needle itself too far because it's going to hurt the patient more. You just want to advance with your index finger straight across, and then you're going to wait for the flashback, and the blood should be there. And right when you see it, go ahead and release that tourniquet, and then you're going to place your extension kit right there, which is already primed with your normal saline because you don't want to inject the patient with any air. And of course you flush it, make sure there's good blood return, and as long as the patient is sitting still right here like this, you don't have to worry about, your IV getting pulled or anything. And of course that's in a perfect world, right? So go ahead and make sure that the insertion site is properly covered like so. Sometimes people use tape to secure it prior to even placing this on here, but this is sticky enough at this point to not have to put tape on the inside. And then you peel off the rest of the dressing because you don't need that. And then there's two parts right here. You can go ahead and take this little piece of tape and then put the date, time, your initials, and then this part right here, sometimes people put it underneath to secure it more, or you can simply use it to tape the rest of the IV extension kit like so, and make sure to cover the end of that port right there so you don't get an infection. And that's pretty much it. Thanks so much for watching, guys. Oh yes, and then of course dispose of your needle in the shops container. Comment, subscribe below. Thanks. Bye.